Hey guys, it's Sally here, and today we are in clinic here in Sydney and we're going to be looking at this, cupping. Now cupping has been used for many years, and we often find cupping as an essential part of some of our Eastern traditional techniques. If you're going to acupuncture, you might have moxa cupping and other forms of cupping when you go there as well. The kind of cupping I do here in clinic is purely for fascial release. So I'll show you what to do in a sec, but ultimately what we want to think about is that the cup is going to draw up that top layer of skin and the fascia underneath. And it's going to help create blood flow, some lymph drainage in that area, increase circulation, and also can help to reduce adhesions in those upper layers as well. So we're looking at our superficial fascial layer, our interstitium, that sort of fluffy layer, and then coming down towards our deeper fascial layer on the outside of the muscles. Because of all our fascia is interconnected in our large fascial web, even working in an area of the calf can then spread and have a release up towards the hamstring or the back of the hip. Okay, so let's have a look. So this is the kit I use here in clinic. I got the box off eBay, not too expensive, and within it we've got lots of different size cups. So this would be the biggest one. You can use it on areas like the thigh. Slightly smaller works nicely on the calf, and then we've got little ones here that we can use on areas such as the forearm or the front of the shin. You might notice here as well that in this cupping set there is actually a line just about here. That line's important because that's how far we want to go when we're sucking the skin up inside, or when we're sucking the skin up, lifting our skin and superficial fascial layer. It also comes with a gun. You can also buy these separately on eBay. And then also you will need some cream to reduce the friction on your skin. So let's have a go. And here's our demo. May I present my right calf and shin. So I'm going to pick the cup that I want. So I'm going to start with this size here. It's quite small and it should work quite nicely over the front of the shin. So the muscles here I'm working, tibialis anterior, and the muscles that extend my toes up here towards me. So maybe just having a feel of the tissue first of all, check its consistency. And we want to have some kind of movement check-in first as well. I'm going to then apply a little bit of cream. The cream is important because it's going to reduce the friction so that we can actually then slide the cup up and down. On goes the cup, on goes the gun. Now, this is where I'm sucking up and just to this line. So if I suck up here, you can see the skin gets drawn up and into the cup. I'm then going to reduce the contact with the gun and then very slowly just slide this down. And then I can come straight back up again. Just going to move a little bit more to the side now. So I'm actually coming on, touching up to my perineal group on the side of the calf. So we can drag up and down for as much as we need to. Now, if a gap forms in it, air will come in and you'll lose your suction. So that's what just happened then. So I'm just going to pop it back on again, and then off we go again. Nice, slow, controlled massage. Initially, you may find it a little bit stingy. And if the fascia and tissue is quite adhesed and tight, it might feel a little bit crackly as it goes along. You might see some redness come up as a result, and that's just an influx of blood into the area, which is positive because it's going to bring with it nutrients of healing. You can also, with these cups, leave them in place. So that's more like the traditional style of cupping. You want to keep an eye on this though, guys. Soon as you start to see it going quite red, pull the valve, release it and remove it. You can probably see here I've got my little red telltale sign, and then I can move it down and repeat. So this draws blood up into the surface. As soon as it goes a bit red, release the valve, remove, and then I've got my little circle of redness here. I don't necessarily do this one myself much in clinic. I'm much more about doing the long fascial dragging and massage that way. Afterwards, have a feel, and even just with that small demo there, the tissue here in my leg feels a lot looser. And then sort of check in, what does it feel like as I move my foot around. So guys, happy shopping. Look for these little gems. They're absolutely fantastic for creating flexibility within your system, improving fascial mobility, reducing adhesions, and you'll just feel great. Your body will love it for it. You can do this daily, but if you think about it, it might do better once a week, just as you would do having a massage. So enjoy cupping.